Hi, I'm Thiagarajah. Today I'm here to talk about Botox, fillers, and lasers in your 20s. What's needed and what's not needed. So what I recommend to patients in their 20s is really having a great skincare. So using products that really provide good sun protection. That's probably the biggest foundation for patients in their 20s. Of course, doing lifestyle things such as working out and not smoking is very important. In terms of Botox, I recommend to patients just to really use a very light dose of Botox. The purpose of the Botox in your 20s is really not to get rid of any lines and wrinkles, because most people in their 20s don't have that. But what they do have are dynamic wrinkles. When they move their face, that's when the wrinkles show up. And it's really, the Botox is really there to soften that line from forming. So what I recommend to people is really use light doses of Botox in the forehead, crow's feet, maybe even the glabella area. That's the 11s, those two vertical lines between your eyebrows, to help prevent those lines from becoming deeper in your 30s and 40s. In terms of filler, there really isn't a need for patients in their 20s to use filler as a volume augmentator, but if some patients in their 20s want to have their lips augmented, have a little more volume in their lips, or are born with lower eyelid hollows, that's where you have a hollowness underneath, that's where filler can be helpful for those patients. Finally, in terms of laser, I really don't recommend that patients in their 20s get any facial lasers unless they've had excessive sun damage. If you've grown up in the mountains and you've had a lot of UV exposure on a beach, you might have a little more skin damage than the average patient, and you may need to have a laser, but usually for the vast majority of people in their 20s, I think that's probably unnecessary. Thiagarajah here. Hopefully that helps patients in their 20s know the basics of what non-surgical cosmetic things we can do to help them. Hope that helps you.